Welcome to the Rare Advocacy Movement's Adults Living Rare Advocacy Discussions. Grab your beverage of choice and enjoy today's discussion. Living Rare as a Woman.
Hello, fellow adults living rare. My name is Ella, and I have the honor of facilitating today's discussion, Living Rare as a Woman. Today, we will establish why it's important to focus on the impact of being an adult living rare on a woman's overall health and how we can advance our health. So I want to introduce our participants today. Today we have Andre.
Thank you so much for having me. It's a pleasure to be here and to meet you all. I am 32 years old. I'm from Vancouver, BC, and I am representing the McCune-Albright community. So just looking forward to this discussion.
Thanks for being here. Nadia Bodkin.
I'm actually also 32 years old. I currently reside in New Jersey, and I personally represent 3 rare genetic conditions. One, a rare connective tissue disorder called Ehlers-Danlos syndrome, a rare blood condition called thalassemia, and a rare genetic protein deficiency called alpha-1 antitrypsin deficiency.
Thanks for sharing. Uni Neha.
Hi, I am 29. I'll be 30 actually in March. I'm in the process of whole genome sequencing, so I'm waiting for that. I'm representing the undiagnosed community today.
Thanks for being here today. And Kadeen Robinson.
Hi, everyone. Thank you for having me. My name is Kadeen Robinson. I am 31. I will be 32 in April, and I am here representing the sickle cell community.
Thank you all. And my name is Ella, and I'm 28 years old, and I'm from Richmond, Virginia, and I represent the cystic fibrosis community. And I have been involved in patient advocacy engagement for the past few years, and I've come to understand just how valuable our voice is to industry's understanding of the needs of patients. Having a rare disease and being a woman, it can have significant impact on our reproductive health. And so I pose a question: do any of you have experiences where one of your disease specialists expressed concern regarding how your diagnosis affects your body as a woman? And I personally have found this to be a rare occurrence. With having CF, I see a pulmonologist, and never once has my pulmonologist communicated the impact that CF might have on me being a woman. And so I'd like to ask that of you all as well. What have been your experiences?
I have 3 rare genetic conditions, and not one specialist ever mentioned the impact on me as a woman, other than you might not want to have kids. And it was just a judgment. It wasn't even, well, let's see, what your reproductive future might look like, or actually open up that conversation and first see how I felt about it. So I am curious what kind of experiences the rest of the group has had.
So I have McCune-Albright syndrome, but it is a spectrum disorder, meaning that I also have acromegaly and something called fibrous dysplasia. So it's a disease of the bones. I also have a prolactinoma. It's a condition that basically there is an overproduction of prolactin that makes breast secretion. So it's almost like you're pregnant and you're breastfeeding, but you're not. So that's the major feature of the disease. And so because McCune-Albright syndrome has all of these conditions that affect the body's hormones, I have had conversations with my endocrinologist and various other doctors about the changes that are going to happen throughout my life. And in fact, I had precocious puberty starting at age 3. So I got my period at age 3. I started developing breasts, and then again, the lactation or the pseudo lactation that happens due to prolactinoma. And then I also grew up really, really fast because I had that gigantism. So it was a major discussion in my family. But I can say it didn't go deep enough about how my perception of what a woman is or what kind of woman I am. We never touched on those aspects of being a woman. We mostly looked at the sexual reproductive system. So my parents were worried that I might become hypersexual. And that's actually at the advice of my endocrinologist. So he advised that I would become hypersexual so that they would have to manage my relationships or put a curfew or just kind of watch my behavior. But it mostly focused on the physical aspects of the disease and how it can affect me throughout my adolescent years. And again, we stopped talking about it after about 13. So this was mostly something that we talked about in my early childhood up until 10. I would say.
So being that, you had puberty so early on, was there a lot of communication then between your endocrinologist or your specialist and a gynecologist? Did you ever see like a women's health specialist?
No,
And
never.
endocrinologist
I
go
didn't even
to-
know. Yeah, I didn't even know that a women's health practitioner existed. I just interacted with my endocrinologist, and he knew everything. So he gave me advice on diet, on how I would behave in the social setting as well. So I felt like that was interesting. But no, there was no therapy or women's health or talk about gender, sexual orientation, anything like that.
Andra, I'm curious, was he correct in his predictions about your behavior?
Yeah, that's a good question. I was thinking about it last night. Actually, because I grew up so fast and I stopped growing at age 13, whenever I would go to see him, he would start talking about how I look like a model and how I'm going to have a great life because, I'm so tall and beautiful. And so I felt like he was projecting his ideal on me because I was, in a way, his prized patient because he's never met anybody with McCune-Albright before. And I guess that made me special in his eyes. But yeah, he was projecting a lot. And when he would be saying these things, he would also be saying it at an age where I didn't even know what is a supermodel. Like dating, what's that? I was 8. I had no idea. Yeah, it was his projection because it didn't align with anything. I'm not a model and I'm not like a femme fatale woman.
My disease also affects my structure. I have marfanoid structure. And so I'm tall and stretched out as well. And I was told the same exact thing that, oh, you're lucky, you have the model figure. And it's amazing. Like I've had people come up to me and say, I wish I had your body. And I'm like, be careful what you wish for because it's really uncomfortable in being in this body. I have chronic pain because of my condition. So it's just funny how people's biases they project that onto you.
I think this is also something that, not just in the healthcare space, but in our personal relationships, with those around us, those with CF are typically malnourished, underweight. It's a very, very thin, don't have to worry about calories. We can eat anything we want and not really gain any weight. And so, yeah, I've gotten the same thing. Oh, like you're so lucky you can eat whatever you want. And, you're never going to gain weight and how awesome that must be. So that's definitely a correlation also that it happens also in other diseases too.
So my hematologist, when I was younger, when I started to talk about, boys and that sort of thing, she made it a point to tell me that I had to be careful with who I chose to date because sickle cell is a genetic disorder and I had to make sure that I screened everyone, tell them, hey, I have sickle cell. Do you have the trait? Do you have sickle cell too? Not to produce any children that could potentially have sickle cell as well. So our conversations really were centered around those topics more so than my body type or any type of conversation regarding that, other than the fact that if you do get pregnant, you have to realize that you are going to be high risk.
That's very interesting. Yeah, as cystic fibrosis being also a genetic disease that is caused by a recessive gene, I never had those conversations at all. It was not something ever talked about, and so that's very interesting. I mean, I think I always knew it, but it was never something that they really brought up.
I think it helped because my provider, when I was a peds patient, was a woman, so it made it a little bit more comfortable to have those type of conversations. I know that I felt more comfortable talking to her about these type of things because she was a woman. I think that's why we had these conversations, and she was very open when it came to discussing certain things, particularly sexual health and reproductive health. So I think it matters what your provider's gender is.
Yeah, that definitely makes me think of that as a next topic of conversation being, do we relate better to female providers, and can relationships with female providers provide a better sort of discussion or more comprehensive discussion and bring up topics that might not with a male provider?
For me, because I went undiagnosed so long, nobody, prepared me for anything. First, I started out with all of my care in the Dayton, Ohio area, and that was where I went undiagnosed so long. But when I recently moved to Cincinnati, Ohio, last year, I was able to find physicians that pointed me, at least in the rare disease community, more so. I just did a Beighton scale exam, and that was where I was diagnosed with hypermobile type So the physician that diagnosed that, he told me that EDS actually more than men, in the sense that we can start out in our childhood the same way, like boys and girls can be affected the same, but usually by the time we hit puberty and grow into adulthood, because men seem to have more muscle mass, it carries in their connective tissue better. And that women, we seem to have more progression or digression in the disease. I actually do have two children. My son will be 6 in April, and my daughter just turned 4 in September. So I went completely undiagnosed and had, no idea. Right now, their physicians wanted to wait as well until I got my whole genome sequence, just to see if maybe there was something else there. So they're kind of paused on getting them any genetic testing done until I get that done. But as far as reproductive health, I seem to have the same response that more of the female physicians seem to be more understanding of what's going on that end. But because I was so late diagnosed, no one was able to talk to me about, like, as far as my children. But I've had a lot of reproductive issues as far as surgeries and whatnot over time. That's why I have like 2 different physicians, the OBG and the urogynecologist. But I did kind of have the same thing, even though I went undiagnosed. I'm kind of taller and lankier on that end, and I was always just told, you should be a model. And even at all the other health issues I had, it's like, oh, I want your body. And I had the same experience, like Nadia, like, be careful what you wish for, because you don't know what it feels like going through this. But if I would have known at least what I had, I could have talked about it. But from my perspective, with being undiagnosed, it was really hard. Having a rare disease in general is hard, but then being undiagnosed in the rare disease community is even more confusing, because no one knows how to treat you, and there's just even less that you're prepared for. But at least I'm grateful that I could move forward in the rare disease community, for sure.
Thank you for sharing that with us. Yeah.
Thank you.
I don't know. I don't have a perspective. I've always had a male specialist, a pulmonologist. And so I have no idea how conversations might have been different growing up, especially like in adolescence and then into my young 20 years, how that would have helped to facilitate some conversations. I guess some of the topics that are relevant in reproductive health and CF is that CF take a lot of antibiotics to treat lung infections that are the predominant symptom of CF. And so a lot of antibiotics, as we know, can really mess with gut health and then also reproductive tract health, leading to yeast infections and BV and things like that. And that's very common. But none of that was ever mentioned. And the gynecologist that I've been to for a while now never has treated a patient with CF before, and really wasn't, aware of these specific issues that can arise. And I can't help but think that better communication between our rare disease specialists and specifically gynecologists can bring better awareness to both sides of the issues that arise with people with a specific rare disease. And just
I've noticed, like, even just in the rare disease space, there's really no collaborative approach. Like it's literally up to the patient to connect all the dots. I'm curious because Andra's in Canada and the rest of us were in the US. Does Canada have transitionary type of programs because of the universal healthcare?
Yeah, it's similar. I feel like that part of the medical system has just not been developed yet. Yeah, we do have universal healthcare here. And in the province where I am, we actually have really good coverage. But the psychosocial aspect of it is not covered. Specialists don't talk amongst each other very effectively. You as a patient have to make sure that they get news of the information. Oftentimes emails don't get through, faxes don't get through. So you have to actually make it your mission to inform them of everything else that's happening. And I'm sure you all know this is a major waste of time, right? If we had a better system where specialists could coordinate, it would just be so much easier for us. And as far as transitional programs, I would say that for people who are diagnosed really early on, they need transitional programs for every developmental stage. So as a female child, you have unique challenges. As a teenager, those challenges and those needs change, right? As an adult woman as well. And as you go into older age, they change as well. So I feel like those transitionary programs should look to serve patients for the duration of their life, potentially, if it is a lifelong condition, like a lot of the rare diseases tend to be. But no, we don't have transitional programs in Canada.
Does any of you feel like, looking back, where would be the best transitionary professional? Like if you had to choose one, for me, it would be when when I was getting into a university, when I was trying to become a professional, choose my profession as someone who is like struggling physically. And there was just no guidance. That's pretty much what got me into the medical field, was just because like I have to fix myself first before I can decide what I'm going to do as a professional. So I'm just curious if any of you have like that pivotal point that you feel like if I had only known, or if I had some help, what what point would that be?
Yeah, I would say that for myself, that your experience resonates because every time I had to go to a new school, I had to enter a new stage in my life. So I remember particularly going from home to kindergarten and going from kindergarten to primary, then high school, then university. So I feel like for each of those pivotal moments, I would have needed a lot of guidance because when you change your environment, um, your needs change as well, and you have to reorient. So in order to do that, you need to know yourself really well, and in order to know yourself well, you need to be able to distinguish between the side effects of the medication and what you're actually feeling, A, and then B, you need to orient in the space as a person living with a rare living with an atypical health, I want to say, because when you grow up, you just think, oh, I have an ethical health, and you always have to relate to the environment, to everyone else differently, right? So for each of those milestones, I would have needed a transitional specialist or somebody in my healthcare team who could guide me. And I want to echo what Ella was saying, that we may relate differently to different genders. And so when I was growing up, my primary specialist had a sidekick who was a woman. And I always looked up to her. I always thought that, oh, maybe she's going to talk about the real stuff to me. Maybe she's the one who can talk to me about the human aspect of it. But that never happened. So I did look up to female practitioners in the field as I was growing up.
I definitely feel like for me, looking back, I would have preferred to have a transitional provider or have someone talk to me really and truly about what to expect during puberty. Because, as a sickle cell patient, you're dealing with crises and, stress is a trigger. And another trigger is your cycle. And so a lot of patients have had situations where, their cycle has gotten so bad that it's causing crisis after crisis. And for me, I would have liked to have known about what to expect during the time where I started seeing my cycle. And I know, people say it's not, or at least I was never told about gynecologists at that age, but I would have liked to at least have seen someone to talk to them, not only about, me having sickle cell and dealing with the potential crisis aspect, but also, okay, you're not going to die just because you're seeing blood, but, this is how you deal with it. And this is how you make sure that you monitor and you manage your stress properly, because it can trigger a crisis.
With everyone, a transitional person would have been nice around for me, like about 11 as well. And then going into university, college, it would have been a great time because I had a similar experience as Nadia. Like that's when things got like heavier. So you have no one guiding you, and you're an adult now, and there's so much more piling on top of you with responsibilities and things you want to do, but you have like nothing. You're blindsided and everything, and you have to really find your own path. So it would have been nice to even have someone even a little bit like before that, like even in adolescence, so that way we could have started transitioning a little bit while we still had support with our parents and everything, and then had an adult supportive transitional person would have been great.
Yeah, it's really interesting to look at the experience of women with a typical health who get their period at a typical age, and see that actually a lot of the times they don't have guidance in that aspect either. And for us, for people who who have a different experience, it's almost like it goes over our head a lot of the times. I feel it's something that nobody really knows how to talk about, and so it's invisible. And we go through all of these experiences that are major and triggering, but we don't know how to relate to them in our close circle and just in our medical community. I think it's a problem for women in general, the period awareness problem, and for us, the effect is amplified.
Yeah, and along those lines, I think that as women with rare disease, along with having to go through these changes in life stages, compounding that, our chronic or our rare diseases are really the focus and where we have to put a lot of our attention and our efforts in maintaining and stress. And so I think a lot of times maybe we, at least from my experience, I didn't put as much emphasis on my reproductive health and understanding and really, although there were issues that these same issues that you all bring up were happening with me too, but I had a lot of other problems with my lungs and needing antibiotics and hospitalizations because of that. It just kind of went further down on the list of problems and weren't necessarily addressed. So, when I was talking to my doctor about, oh, I'm feeling really sick now, I need more antibiotics and I think I have to go in the hospital. And, he was telling me, Ella, I think you need to be hospitalized for this infection. Maybe I did have concerns with, women's health related issues, but I didn't address it and I didn't bring it up. And I think that's just also an important factor in that, we have these other compounding problems to where, we are having to put these I guess issues or some of these other priorities in a lower ranking. And so I think that's just an important factor, I think, for all of us.
Yeah, I totally agree. Like the priority of actually like figuring out how to be a female when you're a rare disease person is like at the bottom when you're just growing and evolving. And it would be nice if the adults in our life had some sort of like understanding, or at least the adults in my life had some sort of understanding to explain to me that yes, you are a female. This is, a lot of times being a female and trying to explain pain to the doctors, that's a whole other experience that doesn't necessarily convey very well because of the whole hysteria factor and the biases that come along with healthcare because you are a female. And then adding on being a person of color, my mom's Black. So whenever my mom brought me to the hospital, it was very difficult to get care. And so there's like so many components to society that you have to deal with when you're just like trying to survive a rare disease experience. Like I have a million and one heating pads. That's like my lifeline.
Heating pads for me as well.
So yes, so this coping mechanisms for a sickle cell patient is a catch-22. Because when you're in the hospital and you're in crisis, but you're using your coping mechanism to get through it, providers see you as, oh, you're comfortable, so you're not in that much pain. If you're listening to music or watching a show, you're seen as comfortable. And that's far from the case. So yes, my coping mechanisms may be, watching a movie on Netflix on my phone or heating pads, like you said, Nadia. But again, like I explained, it's a catch-22 when you're in the healthcare setting, especially within the ER or even on the floor. You're deemed, oh, you must be comfortable. Your pain is being managed when honestly that is far from the truth. For me, coping mechanisms are just like watching television, reading with I can, finish a sentence in a book without, having to stop and start is enormous. And if I can't, then I know that, okay, the pain is way too severe. Let me put the book down and listen to something, in terms of music or what have you. But heating pads are definitely a godsend.
Yeah, for me, I kind of went inwards and I developed a meditation practice when I started, I think, when I was in grade 1. And I just decided, everything is too much. I think I didn't know how to relate to everything. I was in the MRI machine and I wasn't supposed to move at all. I wasn't supposed to blink or swallow or anything for a long time, for about 40 minutes and 10 hours. And so I closed my eyes and I started to focus. And that was the first visualization that I had. I imagined this white horse with wings just kind of flying towards me. And that was an epiphany for me, because I realized that actually I can imagine things. That became a little bit of an escape for me whenever things got confusing. I would just meditate, and I would do it daily. And it really helped me. But I didn't see it as a coping mechanism. That's to say that nobody taught me that I need to have coping mechanisms. I didn't know what a coping mechanism was. So I just kind of naturally came to discovering that I have an imagination and I can escape in it. So yeah, I wish that people would have asked me how I'm doing, but because I am kind of like a poker face, everyone just assumed that I'm fine, so, and I never really talked about this stuff about my health. So yeah, there was never any discussion about management or coping.
I'm 100% with you, Andra. That was my methods too, was mainly meditation, the heating pads. But I like how you said how you went in. That was how I made it through almost 30 years undiagnosed with everything that was going in to out. When we were talking about like more metaphysical, spiritual. So that was how I really that was my main coping mechanism as well.
I think that, all these ideas are really, really point to the fact that we become so resilient with dealing with these obstacles that we don't even realize that we are coping with it. And, we're really getting through these really difficult times, hospitalizations, surgeries, unknown times in our lives, where we don't know what's wrong with us. And we're getting through it and we're acting normal. And that's because our coping, and that's the resilience that we have developed just from being bombarded and having these issues nonstop, on and on. And, this kind of makes me think of, I think women tend to be, stereotyped. They're thought to be more sensitive and volatile in our emotions, and maybe not as stable. And obviously from our conversation here, we can really show that all of us here as women are in fact quite the opposite. We are very resilient. We control how we act in situations, and as our disease manifestations affect us. And so I want to ask, like, how have you experienced, some of these stereotypes directed at you by healthcare professionals, and how have you dealt with it? And have you ever been like accused of being too emotional, perhaps when there was a time that was particularly very difficult to deal with? And how have you kind of overcome those?
I can go first. For me, my endocrinologist was my primary specialist. Advised my mom she first worried that I may be intellectually challenged and that I might plateau at a certain age. So he advised my mom that she put me in a school that is stress-free, where I can find my vocation instead of feeling under pressure to perform for the academic classes. So my mom put me in our school, and in our school, we deconstruct everything, gender the first thing that we deconstruct. So I never identified with femininity or the idea of being a woman until later on, when I realized what being a woman is. for me. So that was in my school world, in the outside world, but in my inside world, my family, as far as they are concerned, they were just happy that I was around, and they didn't pressure me to act a certain way or be a certain way because I was female. And for that, I'm very grateful. So I feel like because I had such an atypical upbringing, the conditioning escaped me, or I escaped it. I was lucky from that point of view, I think, because now I can look at it objectively and see how it relates to me. I never related to it first and build this a sense of self that way. So I'm doing it the opposite way now in my adulthood. But I think if I wouldn't have been, such an atypical kid, they would have probably conditioned me to be a certain way, because they conditioned my brother, who has a typical health. He had up until recently. He's been diagnosed with MS. So now he's also a special person in our family. So he's not expected to perform to certain standards of masculinity anymore. But as he was growing up, I think that he was, more than I was, expected to perform to standards of femininity in my culture.
I always just thought I was an alien that just kind of like was maybe like placed and swapped out, like, and just handed to my mom, and she just took me in, because I just didn't, I felt like I didn't belong really anywhere. And because I've always had chronic pain, and it just progressively got worse as I aged, I would complain, like as a kid, and just stop walking and just be like, my legs hurt, my legs hurt, my legs hurt, my legs hurt. And my mom's like, okay, like, we get your legs hurt, but you can't keep telling people that. And I understood what she meant, because hearing constant negativity is a downer. And so that's when I realized, I'm like, yeah, I don't want to bring people down. I just was stating my reality. And that's when I started actually turning in, like, as Andra said, and figuring out ways to deal with the pain as I was living with it, and only express it when it had gotten to a level where I couldn't tolerate it anymore, instead of constantly making statements. So that actually helped me as an adult to learn that young, because the pain's never gone away. It's just progressively gotten worse. So learning to live with this constant sensation and not constantly try and explain it to people and describe it has really helped. And with doctors, as you're trying to explain an experience, having an invisible condition, and then having a body type that they're saying you should feel lucky to look the way you do, it feels impossible to try and get any sort of serious conversation going. I was lucky to have a handful of healthcare professionals that was able to put their biases aside and actually listen to me as a human.
Yeah, the idea you touched on, that a lot of our conditions are invisible, although they really affect us on the inside, to the average person, and even a lot of healthcare providers that aren't looking at your chart and seeing, okay, well, Ella has, 30% lung function. Yeah, she probably can't breathe very well without oxygen. But, if I was just I've had so many times where, I'll walk into a doctor's office and they'll be like, oh, you look so good, like you've been doing well. And I'm like, actually not so good. And then, going into details from there, but it's very deceiving. And a lot of times I've felt that I feel like I'm over exaggerating my issues when I know that I'm not, but I kind of try to like downplay them. Even in the healthcare setting, not alone, especially with friends and family that just don't really get it. But yeah, even in the healthcare setting, I found myself to do that many a times where, I kind of make my issues, express them less, because of that feedback that I get automatically of like, oh, you're looking so good, and you're feeling good, and those kind of comments. It really does affect us, I think.
Growing up for me, I thought I was an alien too, and that I felt like I was placed here. So Nadia, I completely get you on that end. I wasn't understood by the medical staff, like the same thing, like your body looks good. And even now, even though I have people that say I have EDS, I'm still told like, well, you look good. And it's still one of those things where it's like you said, your lungs, even if they're not performing well, just because you look well, you may not have been feeling well. And I hid most of my life from everyone, whether it was family, friends, even the medical professionals, the true extent of what I felt, because I kind of had the same upbringing of, not everyone wants to be brought down with the negativity. Even as a child, I used to have to sit down and take breaks a lot. Even taking showers, I used to have to sit down in the bathtub or just sit down in the shower because I would have a hard time standing. So I grew up kind of similarly in the sense of having to hold that resilience, that strong face, all the time. You never getting a chance to really be honest about it. And really coming into knowing now that I have a rare disease since I was later in the game, finding out, for me, that was where I feel that gave me the courage to want to share more. And now starting to be able to share, there are not always good days. There's days where there's flare-ups or there's pain or you may have to go through surgeries. There are days where it's not as bad, but what I've been holding and keeping hidden for so long, now I'm starting to want to express that because I don't feel like it matters what everyone else, feels. The truth needs to come out. And there's too many of us, even though we're rare, there's still too many of us in the world that we're not being heard of. Our voices need to be heard.
Living with sickle cell and living with a disease that is invisible, and the manifestation of said disease is pain. It is very difficult to express what you want to say to providers, especially when you're in the ED setting and you are deemed a frequent flyer or being accused of being a pain pusher or just exaggerating your pain. It's difficult to talk to your provider and say, well, no, this is not me exaggerating my pain. This is me expressing, my pain in a matter of fact way. And how dare I, at any point in time, tell a doctor what works best for me? Then it's definitely you are being disrespectful. You're, not giving what you're telling them what works best for you because they're seen as I went to medical school instead of, okay, I lived with this disease for X amount of years, so I do know what's best for me. So it's a very delicate balance to talk to providers and then, say to them, hey, like this is what I'm living with. And I know you have your 2 sentences worth of medical school education on sickle cell, but I'm coming from a perspective of I see this day in and day out, 365 days, 24/7, all day, every day. So your 2 sentences versus my years length of knowledge, I think I do know what's best for me. But then you also, you have a mom who is very much Katie, fight through the pain. And it's like, well, how do I do that when the pain is so unbearable that fighting just seems like I'm tired of fighting? But then you still have to make sure you understand, again, the balance of chronic pain versus acute pain and wishing that people around you understood and for one moment felt what you were feeling.
Because really, I think we have a lot to say on that. And really, how our experiences with the disease are, so valuable in helping physicians understand our condition. And then, of course, for advocating for our own care and our needs and how we can best to optimize that together, working with our care teams and professionals and really the entire healthcare industry. We are at the end of our time. And I'm so glad that we could have this conversation today. It's really been really fruitful, and I think collectively we've identified, key issues as women with rare disease and strategized ways that we can, circumvent and bridge gaps in care. And I want to thank you all for taking the time to join this conversation. And I look forward to future discussions on an array of topics involving optimizing achieving optimal care for rare disease communities. So if our viewers have any suggestions for future topics, we welcome them absolutely. And I just want to thank you all for joining our conversation today. Thanks for being here.
Thanks.
Thank you so much.
Thank you so much for having me.